Well, each week we have the pleasure of meeting one of the doctors over at Kaiser Permanente of Orange County, and today we have Dr. Harriet Brown. She is the Director of Education over there. Thanks for joining us this morning.
Thank you.
Director of Education, I imagine that's a pretty broad title.
Oh, it's, yes, I direct all of the patient education that Kaiser provides, and also our nursing education and physician education.
You want us to talk specifically today about cooking for one. I imagine that's quite a challenge for a lot of people.
It is. In 2003, I became a widow, and I began to, and my children were still home, but as they went off to college, I found that I was cooking for one, and it was far more of a challenge than I thought. You know, cooking's such a social activity, and it's an activity of great affection, and yet when you're single and not, you know, not having that audience, you tend not to pay as much attention to it.
It's a lot easier to just go through that drive-through and grab
You
whatever
bet.
you
Or
feel like.
Or the typical thing, I'll just have a bowl of cereal.
Yeah, that's true. It's so much easier, but like you said, it's a social thing, and I imagine it's something you really need to become a habit of doing.
Exactly, and you are an important audience to yourself, and that's what I began to see, is that it was so important that I pay special attention to myself and eat healthy, and so I could be healthy, and also because food is pleasurable, and when you cook you really get a quality meal. What
did you find was the biggest challenge for you when you changed over from cooking for four, I would imagine, to just cooking for yourself? Is shopping the biggest difficulty?
Well, shopping, it wasn't so much shopping, it was recipes. Everything is for 4 to 6, and you know, it's hard to cook something up and then eat it day after day after day. And I didn't pay enough attention to my vegetables, and you know, being in health education, you know, you have to be a model, you know, of eating, and I try to do, you know, live what I do at work.
Right.
And
you kind of have that tray of lasagna on Monday, and you see it on Friday as well.
That's
so
right.
You need to really think about that.
Exactly, and especially, you know, living in this area where we have wonderful farmers markets. You know, there's the one near UCI, and then there's one at Kaiser at the hospital on Sand Canyon every Friday.
Yeah. How difficult is it to kind of divide that food once you start cooking for yourself? Obviously, you're buying less, I would imagine. You're making less. Now, how do you kind of present that the rest of the day and the rest of the next day? Well,
what I've discovered is 2 things. One, if I cook a healthy recipe, I can use my handy containers and divide it and freeze it. And this way, when I come home and I'm exhausted or I'm really hungry, instead of grabbing something that I shouldn't grab, I will grab something healthy and defrost it.
Right. And then this is a nice little card you have available at Kaiser Permanente
Exactly.
as well. Nice, easy recipes for someone that is single.
Right.
That they can make themselves, and it's not too difficult.
Exactly, and it's healthy, and it has, you know, low fat, low sodium, decent number of calories.
Yeah. Part of your job, obviously, is education. Is that the most difficult part, is educating your clients on vegetables and other, you know, nutritious foods? Well,
yes, and I think what we do for our families, we often do not do for ourselves. And paying attention to the fiber and the vitamins in vegetables, and plus it's filling and delicious. And in the United States, we have a real problem with obesity, and eating more vegetables and high quality protein is a way to fight that, along with portion control.
For your evening meal, what kind of portions do you think is sufficient? Usually people kind of go a little heavy in the evening meal. Do you find that to be the case, or should you kind of eat smaller meals throughout the day?
People's eyes fool them, you know, and so we will tell our patients, and I will tell myself, you know, you need 3 ounces of meat, and I will take, you know, look at something and my eye will say, this looks like 3 ounces. But we have rules of thumb, you know, meat should be the size of your fist. And, you know, measure. You have measuring cups, and when you measure, your eye begins to train itself to what decent portions and appropriate portions look like.
Right.
And vegetables, you can always eat more.
Sure. And always, I think too, I was just thinking, if you're single and you have a friend, invite them over one day. And
Exactly.
then, like
Even
said,
if
make
you
it
do your
social.
portion, you can do defrost 2 of these, have a salad, and you're ready to go. And you can also cook with friends.
Right. And you have many resources available, and this book is one of them that you had brought. This is a book particularly for vegetarians.
Right.
But it also tells you a lot of important information regarding vegetables and grains and,
Right.
and maybe morning drinks as well.
Exactly. You know, instead of using white rice, for example, you can, I know that Trader Joe's has mixed grains and things like that you use instead, and it has quinoa and barley and all these good high fiber foods. And get to know vegetables you've never eaten before and try them out from the farmer's market.
It's like being a kid again.
It's like being a kid again.
Squash was always my challenge.
Well, you can do things with squash, you know. You can make ratatouille with squash and Provençal vegetables and make it a treat.
Yeah. In the last couple of years, we've heard so much about organic. Everything seems to be organic now, to some extent.
Right.
Is that the right direction for nutrition?
It
for some
depends.
people?
It depends. I mean, some people feel that taking the organic route will prevent them from having certain additives like hormones, and sometimes for example, with chicken, free range is sometimes combined with organic, and that becomes, you know, a humanitarian type of thing. But most vegetables, the way they are grown now, are safe and certainly add to your health.
So it's more of a personal choice as
Right.
well there. Yeah. Now, we've talked a lot about food, but how important is water to someone's nutrition?
You need to be hydrated. And you need to drink water, not fruit juices, which are high in sugar and high in calories. But, you know, keep a bottle of water with you, and that becomes, as you grow older, a real health problem of being dehydrated.
Right. And when you were talking about water, we're not just talking about a little 8-ounce glass of water. We're talking about 32 to possibly 64 ounces
You
of
know,
water.
you can use your water in tea and in things like that. Keep your caffeine down for the sake of your family and friends. But yeah, just keep hydrated.
Well, what kind of resources do you feel that people can use to become more educated with nutrition? Does Kaiser have that kind of information on their website?
Absolutely. At kp.org we have information. We have a health store that provides books and other resources on nutrition. For example, if you're diabetic, you want to get, for example, the diabetic meals for a month that the American Diabetic Association publishes, or if you have a heart condition, the American Heart Association.
Right. And of course, these wonderful
these
little menu items are terrific, right?
Right, that are
this
produced
is the
by
Southwest
Kaiser.
burger, and that sounds pretty good.
Right, and you know, they're a recipe for 6. You just eat one and freeze the others.
That sounds pretty good. Well, thank you very much for coming on
Thank
our program
you.
this morning and educating us a little bit about nutrition, which we all need. And give them a call at Kaiser Permanente. That's 932-2052. And of course, check them out on the World Wide Web at kp.org and get all your nutritional information. We'll be right back right after these messages.